Our first proposal will involve increasing the number of antibodies in an individual's blood. It will consist of a transfer of blood plasma from one person to another, which is going to help boost the adaptive immune system. The adaptive immune system is the body's built-in defense system that eliminates pathogens that enter the body. We will have to take blood from a patient who has recently recovered from the virus. We will do this using plasmapheresis instead of taking whole blood. Even though the patient needs to have an AB blood type, plasmapheresis is easier because it can be donated more often. After that, we will inject it into patients who have contracted COVID-19 and are willing to try this treatment. This would aid in boosting someone's humoral immunity because the blood contains antibodies that help inactivate foreign substances inside the body. When someone has the virus, the body creates antibodies specific to the virus or strain in order to protect itself from the virus coming back. This is due to antibodies' memory, which allows it to recognize and attack pathogens. These attacks are usually stronger compared to if the antibody has never been exposed to the specific pathogen. While this method of treatment is definitely not common, I found multiple accounts of research that would back it up. The first one is from 1934, when Dr. J. Roswell Gallagher extracted blood from a student who recovered from measles. He then injected the plasma into 62 of his other students who had been exposed to him, and only 3 of them ended up with the disease. Although this research is not very controlled, it still shows that the method could lead to promising results. Another much more recent study was done in 2014 in response to Ebola, which is much like the coronavirus. They concluded that plasma therapy could be very effective, and it is already available. However, they did not get the opportunity to test it out during this pandemic. I feel that these 2 trials have proven that this method of treatment is worth a try. Please consider this option so that we can recover easier from this global pandemic.
Okay, so for our second proposal, we will be increasing the number of macrophages in an individual's blood. Macrophages arise in response to T helper cells, and macrophages are prodigious phagocytic cells that clear many erythrocytes each day. This equates to almost 3 kilograms of iron and hemoglobin per year that is recycled from the host to reuse. This clearance process is a vital metabolic contribution without which the host would not survive. Macrophages are also involved in the removal of cellular debris that is generated during tissue remodeling and rapidly and efficiently clears cells that have undergone apoptosis. To do this, we are creating a pill of white blood cells highly concentrated with T helper cells. T cells are very diverse and much more complex than B cells in classification and in function. The 2 different populations of T cells are based on what cell differentiation glycoproteins a mature T cell displays. CD4 and CD8 are the 2 main glycoproteins that mature T cells can display. Unlike B cells and antibodies, T cells cannot see either free antigens or antigens that are in their natural state. T cells can recognize and respond only to processed fragments of protein antigens displayed on surface of body cells. In order to get the white blood cells alone, we will centrifuge the blood to separate the plasma, red blood cells, and buffy coat. Then we will put the buffy coat cells into a pill. The buffy coat is the fraction of anticoagulated blood sample that contains most of the white blood cells and platelets following density gradient centrifugation of the blood, which will increase the amount of T cells in the patient's body and in turn will maximize macrophage activity. Some research by David M. Mosser and Justin P. Edwards supports our idea. They concluded that macrophages display remarkable plasticity and can change their physiology in response to environmental clues. These changes can give rise to different populations of cells with distinct functions. Choosing our method would be extremely beneficial in stopping viruses such as COVID-19.